Good morning. This is Dr. Craig Stern. We are going to be speaking about using data to optimize effective drug therapy and behavioral health today, and we look forward to a robust discussion. Slide 2 is financial benchmarks, and we want to start this discussion by discussing some of the information that we have with regard to pharmacy data that we receive from pharmacy benefit managers who effectively pay claims every time that a patient brings a prescription to a pharmacy. On slide 3, titled OCBHS Financials, July through December 2004, you can see some of the monthly averages that we do just as a benchmark for the kind of information that we have. I'm giving this to you because I'd like you to understand in general what overall costs are before we start talking about some of the individual kind of quality reporting that we can do. We can identify, for example, that the average cost for every prescription right now is about $115, that about 41% of all of our prescriptions are generic, and that a generic prescription costs about $37. We see about 1,244 patients who get prescriptions, and every patient every month costs about $298, and each patient receives about 31 prescriptions per year. On slide 4, we are indicating that not only do we have financials for the entire BHS group, but we also have financials for each of the individual groups or sites of care within BHS, and we can identify both trends as well as the individual financials for each group, which we're going to show you in the next slide. In slide number 5, entitled BHS Group Financials for November 2004, we have some fundamental financials to compare each of the different groups. The first line has to deal with all groups as a overall benchmark, and then we have ADAS, AMHS, our contract groups, etc. We're identifying the total volume of prescriptions here, the total amount that BHS pays for a month, in this case November, what the generic percentages are that are different, the total number of patients that are seen, the PPPM or the cost per patient per month that is paid, and then the utilization or the RX per patient per month. As you can see here, we have a big difference in the number of patients that are seen across the different groups, as well as the utilization, which can range anywhere from 2.5 prescriptions per patient per month. And what you can see is BHS Group Financials, November 2004. This particular slide indicates that we can offer to you information about each of the groups with regard to their total claim count, their total amount paid, generics, etc. So we can compare groups by a host of different parameters. In this case, is their cost per patient, numbers of prescriptions per patient. Please note that there are differences here. Some are have 2.5 prescriptions per patient per month, or RX PPPM. Some have less than 2 at 1.79. So we can give you good comparisons between these different groups. In slide number 6, entitled BHS Group Financials for 2004 in November, you can see that we can also identify other indicators to give us more information. Here you can see that there is the total number of physicians, the total number of patients or prescriptions that are being written for each of the different atypical antipsychotics. The most important thing here is to note that the information that we have is broad, and that we can offer you customized information when you request it, and different information that you see. This information that we have here is some fundamental information that we think will be of interest, and then we'll use that as a springboard for further discussion in the future. Now, the important thing to note in slide 7 is that this is not just a program for managing or trying to give information to physicians. This is an overall management program that we're doing for all of BHS, and one of those has to deal with the Pharmacy Benefit Manager, or PBM, and we'll show you a few things that are being done just for your information so that you can see that we are trying to manage the entire process. In slide 8, entitled Reject Screens, we are indicating the kind of financial information that we're looking at to ensure the fact that the PBM is adjudicating or paying claims the way we want them to, and that we're not paying inappropriately, so that this isn't just information that we're throwing at. In fact, our business office people are using this on a weekly basis as they get invoices to identify claims that should not have been paid, or information that should be rectified and corrected, so that we can be assured of the fact that we're not misusing our funds. In slide 9, entitled Management Screens, we're trying in slide 11, entitled Orange County BHS Prescribing Guide, we have tried to condense down the information from the formulary into something that is only a page or two long and gives you basic information about the drugs, the strengths, the total quantities that should be written per month, the maximum and minimum dosages, and the prices for the maximum and minimum dosages, in order to give you not only information about the drug, but also information about pricing for your cost-effective drug prescribing use. In slide 12, labeled Tablet Splitting, we also want to give you further information that may be of use to you with some patients and not to others, but we want to give a complete and objective bit of information, and in this case we're observing and identifying areas where tablets can be split, and there are some opportunities for cost savings when this is done. Obvious opportunities for this is sertraline or Zoloft, the Celexa, Paxil. These are common ones that have opportunities that have been well established. They're tablet. In slide 13, entitled Drug Cost Comparisons, we want to give you some information that we intend to apply and to give you on a monthly basis that will give objective information about drugs, about costs, comparative information, etc., in order to give you some general issues of interest. Once again, if there are topics that you find of interest, we very much encourage you to let us know, and we will make sure that they are included in future cost containment grants. In slide 14 is an example of one of these cost containment grams that we would send out monthly. This is oral antidepressants, and we're just trying to identify the whole scope of antidepressants that are available, the range of doses, the range of average wholesale price costs, to give you an idea of what the cost is from lowest dose to highest dose, and comparative costs across all of the different drugs. The average wholesale price is used in order to assist you with a standard pricing mechanism, so we're not trying to identify that you can get a lower cost drug at one pharmacy or another. That clearly is true, but this gives comparative information. In slide 15, entitled Comparative Drug Costs, we have yet another monthly cost containment gram, and this on tranquilizers, doing the same type of thing, listing the tranquilizers, identifying the range of dosages, and giving average wholesale price costs for the lowest dose to the highest dose, once again to give you some comparative costs, as well as for you to identify some of the lower cost items, as well as the differential between some of the newer higher cost items. In slide 16, entitled Physician and Patient Specific Queries, or PSQs, we're identifying the fact that the data can be used not just to give you information about cost and monthly general information, but also patient-specific information. And we're going to show you some examples of that in the next several slides. But we want to show you the opportunity out of these the data in order to give you a wealth of information, once again with the capability, hopefully, that this will lead not only to a discussion, but also feedback in other things that you're interested in. So we're going to show you in the next several slides possibilities and information that can be given for these patient-specific queries. Slide 17, entitled Physician-Patient Specific Queries, the breakdown of Strattera atomoxetine by month. This is just purely a financial breakdown in order to give information about certain drugs that are of interest, whether they're of interest to the medical director or perhaps to yourselves as well, about what the activity has been, how much has been dispensed, days supplies, cost per unit, etc., to give you a general idea. And if you're interested in specific drugs or categories, this can always be run, and we look forward to your request. Slide 18, also entitled Physician-Patient Specific Queries. This one is drug totals by month for Celexa and Lexapro. This gives some examples of drugs that are in the same therapeutic category, what their relative utilization is and costs are, and gives you a general idea of comparisons on a monthly basis so that it's not just a one-month snapshot, but here we can give a whole trend. We can also give this information in graphical form. In this particular form, it's in a table, and once again, this is the kind of thing where you may be interested in what you're doing as well as in comparison to what your group or all of BHS is doing. In slide 19, entitled Zyprexa patients receiving more than 30 milligrams per day, this is a standard dosage threshold, and here we're trying to identify a listing of the patient who has prescriptions for Zyprexa more than 30 milligrams per day, with a listing of the different prescriptions on a monthly basis so that you can see the total history. This kind of thing can be done for any drug in any strength. This particular one was used as a particular sentinel kind of event to identify potentially issues where we have high utilization, patients requiring high strength that may require further case management or even further involvement by you. In slide 20, entitled Patients on Multiple Drugs Within the Same Therapeutic Category, we are trying to identify where patients may be receiving multiple drugs, potentially written from multiple physicians or even drugs within the same therapeutic category. This is a coordination of care kind of issue. While it may not be a huge problem, if it's identified, then clearly we want to make you aware of it and let you know so that you can coordinate care with whoever the other prescribers are and be assured of the fact that you have a total picture of that patient. In slide 21, entitled Physician-Patient Specific Queries Compliance Alert, in these kind of studies we are taking a look on a drug-by-drug basis to ask the question whether these patients have been taking their medicines as expected and if they're complying, so that as you modify dose or you're monitoring them, that you can see what their refill history has been with regard to compliance. There are two main issues. One is refill history and the other one is persistence month to month for maintenance type of drugs. These kind of reports show that, and we tend to give you this kind of information so that you can follow up and make sure that you're aware of patients who are not complying when you're trying to modify dose or change treatment. In slide 22, entitled Physician-Patient Specific Queries, the adult report series, we have two main reports. One is antipsychotics plus anxiolytics and sedative hypnotics, or antipsychotics plus these drugs for different drugs to show what the history has been. In this case, we're trying to identify combination therapies that may be questionable or things that you want to follow more carefully. This kind of thing is something that can be customized, and we have just used this as a particular example so that you can see those patients that may be requiring multiple therapies, either due to side effects of one of the drugs that requires a further drug therapy. In slide 23, entitled Physician Patient-Specific Queries, the adult report for the series edits for, once again, antipsychotics plus anxiolytics, sedative hypnotics. Here we're just trying to summarize everything so that you can see which groups have these particular problems more frequently than another group. This is a medical director kind of report, but allows the medical directors, in order to compare groups with regard to some of these type of drug combinations. Once again, this combination was chosen purely for example, and it can be done with anyone, especially ones that you have a particular interest in. In slide 16, entitled Physician and Patient-Specific Queries, or PSQs, we're identifying the fact that the data can be used not just to give you information about cost and monthly general information, but also patient-specific information. And we're going to show you some examples of that in the next several slides. But we want to show you the opportunity out of these the data in order to give you a wealth of information, once again with the capability, hopefully, that this will lead not only to a discussion, but also feedback in other things that you're interested in. So we're going to show you in the next several slides possibilities and information that can be given for these patient-specific queries. In slide 25, entitled Physician Profiles, Top 25 Physicians by Ingredient Cost, we're identifying, just for a medical director standpoint, who are the prescribers who prescribe most of the drug cost. These profiles are going to be sent to you on a quarterly basis, and we're about to start explaining what they look like. But here is a general idea for you to see how one physician compares to another with regard to drug costs. Clearly there are multiple factors that can influence that, but these are purely to try and identify where is the bulk of prescribing, where is the bulk of cost. In slide 26, entitled Physician Profiles, we have a couple of examples of profiles that we will be sending, and we're going to explain each of the different sectors of the profiles to you. But as you can see, some are in table form, some are in graph form. We're going to try and show those to you in various ways so that you can give feedback to us about how you wish to see the information. But this is general information, once again, standing back, looking at your entire practice and comparing it to your peers. The information hopefully is of use to you so you can see what comparative costs are, what everyone else is using for treatment, give yourself an idea of how your practice compares to everyone else. In slide 27, entitled Financial Snapshot, we are looking at the upper left-hand corner of the physician profile. In that profile, we are looking at financial comparisons, your current statistics for comparison. The first line in blue has your particular averages for your average cost per prescription. In this case, the doctor had $136.62 per prescription on average. Their average monthly patient cost, about $448 per patient per month, and the number of prescriptions per patient per month of 3.2. This compares to averages for the particular group that the physician belongs to, and then averages that compares it to the entire groups that have to do with ADAS, AMHS, and contract physicians. This gives a comparison to all different peer groups. In slide 28, entitled Comparative Utilization Table, we're looking at the upper right-hand corner of the physician profile, and in this we're trying to identify what the prescribing is for each physician in comparison to their group and to their peers. In this particular case, we're identifying the SSRIs, and then below that the atypical antipsychotics. The first line are the overall generic prescribing, and in this case, this physician in blue has 55 or 56% of their total prescriptions generic. That compares to the ADAS group that they belong to that has about 42%, and then overall for those that are about 55%. Then each one of the individual SSRIs is listed, and then other of the antidepressants are listed there as well for bupropion, mirtazapine, etc. And then comparative for the antipsychotics in the same way to show the favorites and practice of individual physicians for particular antipsychotic use. BHS Group Financials, November 2004. This particular slide indicates that we can offer to you information about each of the groups with regard to their total claim count, their total amount paid, generics, etc. So we can compare groups by a host of different parameters. In this case, their cost per patient, numbers of prescriptions per patient. Please note that there are differences here. Some are have 2.5 prescriptions per patient per month, or RX PPPM. Some have less than 2 at 1.79. So we can give you good comparisons between these different groups. Reviewing the comparative utilization table, upper right-hand corner for your comparative drug and therapy utilization. In this particular part of the profile, we're identifying to you how your particular prescribing of different SSRIs and other antidepressants as well as antipsychotics compares with your group as well as overall. There are generics here on the first line to give you an idea. In this case, the physician prescribed 55.9% generics versus 42.5% for the others. Very good. And for overall, 55.9%. And then identifies the individual prescribing per each of the individual groups. What we're trying to identify here is that the prescribing per drug can give you information about your prescribing of individual drugs versus others to give you an idea of where some are seeing perhaps better use or greater benefit for some of these antidepressants and atypical antipsychotics than others. This is for comparison purposes only to give you further information. In slide 29, we show that same information that we've just spoken about in the upper right-hand corner, where it has your comparative drug therapy utilization. In this case, it's done as a pie chart, and we're showing the information in a broader perspective than on a per drug perspective, but gives a general idea of where an individual physician looks on the left versus their physician group on the right. It's a grosser view than the individual drug view that we've just talked about. In slide 30, entitled Top Drugs, we are looking once again at the physician profile or the physician trend report in the lower left-hand corner. And here we've identified the top drugs that the physician prescribes, what their total cost was, the number of claims, and then the average cost per unit, meaning tablet or capsule, for those particular drugs to give you a general comparative information. This information, once again, can be customized so we can, as you give us further feedback and we have greater robust discussions about all of this, we can have a conversation about further information that you'd like to have in these cells. In slide 31, of the patient cost trends, or the physician trend report, we are looking at the lower right-hand corner, and in that regard, we're looking at your 2004 comparative quarterly PPPM, or cost per patient per month trends. This is a trend report that identifies in blue your third quarter, and then a little bit farther to the right your fourth quarter, so you can see the trend. In this case, the cost per patient per month is rising, and compare that to the ADAS group that this physician belongs to in the in the orange that is lower, so that this physician's costs are higher than the ADAS group, and the ADAS group's trend is going down in comparison to this particular physician. In slide 32, we're indicating that not only are we profiling physicians, but we're also profiling pharmacies, so that we can give you some information about those pharmacies that seem to be getting most of the prescriptions or doing a better job in trying to ensure that patients are getting, number one, what you want, and if there are opportunities for lower costs, that they're informing you of that. In slide 33, entitled Pharmacy Profiles, or the top 25 pharmacies by ingredient cost, we have a table here. This is only one of the ways that we display the information, but this gives a general comparison of the different pharmacies, not only of their overall cost and the patients they're seeing, but also their comparisons in generic percents and cost per patient per month, numbers of prescriptions per patient per month, generic percent, etc., so that you can see those pharmacies that perhaps are doing better in generics, doing better in average cost, cost per patient, etc., and when appropriate, identifying those those pharmacies that may be working with you better and partnering better with you to give the best therapy to the patients. In slide 34, we've given information about where to find us, so that if you have questions, you have comments, criticisms, or otherwise, you certainly have all of our contact information in order to give us that feedback, and if there's other reports that you want, you can certainly identify that to us. Our overall issue here is that while we have a lot of information, it does no good if we do not share it. Our intent here is to give information that is useful, information that we can use and you can use in order to make better decisions about therapy. We will be sharing it with you in multiple forms, as we've talked about, from monthly cost containment grams on general information to patient-specific queries on information that may be actionable, to profiles that you'll receive quarterly to compare yourself against your peers, as well as to see your entire practice. At the same, for you to be able to see that this program is trying to deal with all of the elements of the drug use, and as far as we can use it from all the prescriptions that are written, we are trying to collect all that information together for your use. We look forward to your comments and your questions and your requests for further information, and we look at this as a very positive step in helping us all to use data and information the same way that we do on an individual patient basis to drive certain care, now to have it on a broader patient basis so that we can compare therapies, compare what's going on across therapies on patients, physicians, etc. Thanks so much for your time, and we look forward to not only robust discussions, but significant discussions in the future.